Vision and eye health are so critical for children in the learning process. As much as 80% of what we learn is through our visual system, and as many as 25% of children have an undiagnosed vision problem that can affect their learning process. The real issue here is that children don't know what normal or abnormal vision is, and they don't know until they have their eyes checked, and often go undiagnosed with conditions that could easily be corrected and treated if they were seen for an eye exam. A few years ago, I had a mom that brought her daughter in for a comprehensive eye exam, and the mom was somewhat frazzled, and the daughter was crawling all over my equipment, clearly not able to pay a lot of attention and couldn't really sit still through the exam. And we found in the exam that she was severely farsighted. And farsighted limits their ability to hold their focus at near vision, and it impacts their ability to sustain their focus to be able to see things at near. So we prescribed glasses for this young lady and saw her again about a month after she got the glasses. And the mom came in with tears in her eyes and said, "Dr. Colby, this is the first time I've been able to sit down and read a book with my daughter, and she's 5 years old." But the glasses enabled her daughter to more easily focus and sustain her focus to be able to see things at near. And that's such a critical part of that learning and educational process that had been missed in this young lady's life. Between 15 and 20% of children have farsightedness, and again, we see upwards up to 25% of children entering school with undiagnosed vision problems, and it could be farsightedness, it could be astigmatism, it could be nearsightedness, but again, kids don't know what abnormal vision is. They don't know that it's not normal to see leaves on the trees. They don't know that it's abnormal to not be able to hold their focus or to be able to read a book for longer than 30 seconds. They don't know that that's not normal, and it's our job to be able to determine and detect that.
Vision disorders are the most common handicapping condition of children.
There's a national program that was started by the American Optometric Association called the Infancy Program. And what it does is it provides complimentary vision evaluations and eye health assessments to determine the status of your baby's eyes. And again, there's so many different things that we can do to adapt the exam to determine whether the eyes are developing together as a team, whether the baby's eyes are healthy, and just even eye reflexes that are naturally developing that determine or help us to determine, are the eyes processing and working well together. So this is a huge program that's taken off in the last 2 years that we've seen a lot more through our practice into determining, again, it's not an eye turn, eye muscle imbalance, but it could be something more organic, again, physical in characters that can, again, affect the way that that child's vision develops. The American Optometric Association and the Minnesota Optometric Association recommends that children have their first vision exam between the ages of 6 and 12 months, and that can be through the Infancy Complementary Visual Assessment Program. And then we like to see kids again at the age of 3, and at that age typically they're more verbal, they can communicate better with us and give us better examination results. And then again at the age of 5 before they start school, again to make sure we're catching any problems along that vision development and make sure again they have a good experience when they start school. At minimum, your child needs to have at least that baseline exam before they start school. Some of the common vision problems that we'll find during a child's vision exam, first of all, would entail your normal, I wouldn't say normal, but your refractive errors, what we call nearsightedness, farsightedness, and astigmatism. And the percentage of that can range between 12% and 25%. Nearsightedness is when a patient can focus better at near than they can at distance. Farsightedness, not quite the opposite of nearsightedness. The way I like to explain it is that they're constantly over-focusing at all distances to see what they need to see, but it's more important and more of a factor at near because we have to focus harder at near. The third one would be astigmatism, and astigmatism has to do with the way the light enters the eye. Instead of straight on line, it enters off center, and that affects both distance and near. And even small amounts of astigmatism can really cause problems with vision, and again are often not found during your normal routine vision screenings. The other types of problems that we find during a vision exam with children would be eye posturing problems, an eye that turns in, out, up, or down. Those typically are the most apparent to parents and usually the reason they come in, but typically can lead to what's called a lazy eye or amblyopia, what we call medically. But a lazy eye is an eye that fails to develop normally. Some of the things that you should watch for in your child if they're having vision problems would be frequent headaches or complaints of headaches, fatigue or complaining that their eyes are tired, if they avoid reading or doing their homework, if they have trouble with eye-hand coordination, especially with sports, that's a sign that maybe their depth perception perception isn't what it could be. If they rub their eyes frequently, if they squint to see at the distance at the whiteboard or blackboard at school or even the TV in your home, if they cover an eye or they turn their head or tilt their head, or if they use a finger to maintain their place on the page, or if they ever have any kind of crusty or itchy eyes, especially in the mornings when you'll notice that the most, those are some signs that you should be on the lookout for and make sure your child has a comprehensive eye exam. I think some parents are sometimes intimidated or don't think that their child would make it through a routine eye exam or a comprehensive eye exam. And there are so many ways that you'll see that we can determine their visual status, that we adapt our exam to be able to get that information from a child. Whether they know their letters or not, there's other ways to test vision. The amazing miracle of technology to be able to have a computer give me a ballpark idea of the prescription without the child having to tell me which is better, one or two. That in and of itself has really expanded my ability as a doctor to be able to treat that child appropriately. So we tailor the exam towards the child. So we use shapes so that they can tell us what their visual acuity is. We play fun games with pretend magic pens. We have magic Harry Potter glasses that we use to keep the exam and keep the child engaged in the exam. We also dilate the child and we let them know we're using magic drops so we can see how many brain cells they have in the back of their eyes. So we have a great time during the exam, and again, it's no different than an exam that we do on an adult. We do a dilation, we can check for glaucoma, we test their color vision, we test their depth perception, how their eyes team and posture together and work together as a team. All of those things are so critical in maintaining, again, first of all, good vision, necessary to see, necessary to learn. Equally as important is the health component of the exam. 20/20 is just one part and one piece of the exam. Looking at the eye health and the entire health of the body through the eye, being able to detect things like diabetes or infections or chronic problems, especially diabetes in our society that's becoming such a huge epidemic. We do a comprehensive eye exam on our children when it comes to the eye health, and we're looking for things like anatomical problems that they were born with that might lead to glaucoma. We're looking for congenital cataracts that could obscure their vision or their ability to process vision. So we're basically doing a whole health screening. Just because we don't see something doesn't mean that child is always completely healthy, but we have seen things in the back of our children's eyes that would prompt a blood evaluation that may turn up or has turned up diabetes. So we're not doing anything different in a children's exam that we don't do in an adult. As a doctor that specializes in the eye, I have an opportunity on a daily basis to work with parents and their children that present with just a routine red eye, which is often diagnosed as a pink eye. But my expertise is being able to determine, is it truly a viral condition versus a bacterial condition, and how to appropriately treat that child, whether or not they're contagious, and to give them the best course of treatment. In addition, we see trauma on a regular basis, a child that may have gotten an injury at school or a scratch on the eye, and again, to be able to determine what is the best course of treatment for that child to preserve their vision in the long term. There's several different ways that we can correct a child's visual problems. When it comes to straight prescription types of problems, we have nearsightedness, farsightedness, and astigmatism. Typically those are corrected with glasses. In some cases, when there's severe prescriptions, we look at contact lenses as an option. Cosmetically, sometimes glasses can be a concern, and contact lenses give the child a better quality of vision. And it depends on the maturity of the child. We have children that are in contact lenses as young as the age of 6. A lot of times, though, there's a lot more parental involvement in fitting contact lenses in a younger child. There's also something called vision therapy, which I think is really it plays an important role in correcting problems in children when we have eye posturing or eye teaming skills. And again, if your eyes aren't working well together as a team, it's more difficult to process what you're reading, what you're seeing, and then to think and learn from what you're seeing and learning. So vision therapy plays also a very important role in some of our patients in helping them in their educational journey. For all kinds of facts, tips, and fun educational and classroom activities for kids of all ages and their parents and teachers, go to www.minnesotaoptometrist.org.